With Marshfield Clinic Health System. Thank you so much for joining us today, Dr. Turney.
Thank you.
And Dr. Turney is actually our outgoing board chair, who has been an incredible leader for the eHealth Initiative and Foundation over the last several years, and has actually been working with us for almost 5 years now, and has just done so much to help advance the organization. So I'm just delighted that she's here with us today. So I was hoping you could actually talk a little bit about how some of the issues that eHI members and healthcare leaders have faced over the years have kind of evolved, because you have been on this journey with us for the last 5 years.
Well, yeah, it doesn't seem that long, but thank you, and I appreciate it. You know, I would really like to start by saying it has really been a fabulous opportunity and really a pleasure for me to serve in this capacity, both as a board member and recently as chair of eHI. It has really been an honor to work with eHI, and I see this as a very important group in really shaping the conversation of how technology can be applied to the healthcare space. And of course, all of us in healthcare, regardless of where we, how we view our lens, is that the discussions on issues and the issues that are important to us have evolved so dramatically over time. And clearly the technology space is no exception. A few of the things, I mean, we've done fabulous work on prior authorization, fabulous work on social determinants, but really a huge value of eHI in terms of the challenge that we all face as healthcare leaders is coming together as a community. And for me personally, you know, I'm a rural health system CEO. And before the pandemic, rural healthcare was already in crisis. Before COVID, rural communities had less access to care. They had worse outcomes than their metropolitan counterparts. And of course, rural hospitals are closing at a record clip for over a decade. So, you know, these were the challenges that we brought into this year. Then we were hit with a once-in-a-century pandemic. So the involvement and the presence of eHI really underscores the need for groups like this who have bold visions and who really have the opportunity to bring those top experts together to talk about big challenges, but also bold solutions.
I think that's a really great point, particularly around the bold solutions piece that you're mentioning. And I wonder, you know, if you could talk a little bit about just kind of the value of eHI and, you know, where the organization is today and where we might go in the future, and what value do you think that members get from eHI?
Well, I'm here because I believe in eHI and I have been a staunch supporter. And I really think that from my standpoint as a health system leader, the value is all the good that comes from convening, from sharing information, and really debating the ideas and debating the approaches that we need to take across the industry. Clearly, the ability to build networks and to build relationships is important, but also to share those ideas with diverse experts, leaders from across the healthcare industry can really create that fertile ground that we need for innovation. Just a couple of thoughts and things that I've been involved with during the last few years with eHI. Certainly, eHI did publish a wonderful report demonstrating how social determinants of health are really critical to understand and are essential to address in order we really want to address, reduce the cost of care and really improve on the quality of care provided by our health systems. By putting the ethical framework for this data together, says a lot about who we are as an organization, and the willingness to really address the social determinants is important in a way that when we collect the data, when we use the data, it has clearly defined ethical standards, and also that there's transparency around the data. And I would also say that as we move forward with eHI, we will be guided by new information and new conversations of our members. And an advantage of keeping this very diverse membership together really creates that environment that conversations are fresh, conversations are focused on really what matters most in healthcare. And I'll just give you one more example. You know, I think this is actually a perfect example, and this has been the work around the data privacy. The issue of how patient data is collected, stored, shared, and utilized to really improve the health of individuals and communities is really one of our biggest challenges. But with challenge comes opportunity, and this really is one of our biggest opportunities, especially in healthcare. So eHI has really continued to influence this dialogue and has really made sure that the patients are at the forefront of this innovation effort.
Yeah, that is so important. And I think, you know, one of the things about eHI is the fact that we bring all of these different multi-stakeholders together. And when we first started the organization 20 years ago, we're on our 20-year anniversary, you know, it wasn't that common to be able to sit down at a table with all of these different key players. You know, now it might be a little more commonplace, but I think we've come a long way in terms of these different different groups starting to work together more. But there's certainly still some barriers and incentives, I think, that keep these different stakeholder groups from working together. Can you speak a little bit about, you know, where you think we've come? Are we better at working together now with the labs and the plans and providers and vendors and policymakers, and what's preventing us from working together still?
You know, we all come from, all the leaders that sit around the table at eHI come from a very different perspective. So you would expect that there will at times be very divergent ideas. And one of the goals that I've had as chair, and I know you have had, Jen, as well, as CEO of the organization, is to really find those areas where we can converge. And I think that in light of the you know, certainly in light of the pandemic, we have had a better opportunity at working together. And really one of the things that has made delivering care much easier during the pandemic has been the allowances made around the reimbursement of telehealth and the efforts that we put forth to make sure that that happened. It's really a collaboration that has been critical to delivering care during this time, and also that we hope will obviously continue into the future. But as I think about the other things that have really brought us together, and again, in a broad perspective, one of the things that really stymied our public health efforts in our state is the fact that there was a simple lack of preparation and investment. And in fact, Wisconsin ranks 46th in the country as a state in the amount of resources that are provided to our public health infrastructure. So we needed our industry stakeholders to work together with us. We needed them to help change our approach to the pandemic through public health and to help identify this as a crisis, and then to create the infrastructure as we prepare for the future. So that has been a huge advantage, sitting around the table with thought leaders that care like we do, even though they might not be in the direct provision of care, to really think again about the issues and to think about potential solutions. And then the whole idea of innovating around care, around the site of care, that collaboration is going to be even more important, because I think all of us have different expectations about what healthcare needs to look like going forward, especially our patients. So we are going to continue to collaborate. We're going to continue to work with partners, and we're going to continue to try to sort out those that really advantage the delivery in a way that we can, you know, for us, deliver on our promise. So I think that is really what's exciting about eHI. The changes that I've seen in the last years that I've been involved with eHI is rapidly changing with the environment as we move forward, and really addressing the most pertinent issues that are on the top of all of our mind, and then bringing people together to converge on great ideas and solutions.
You know, one thing I want to pick up on that you mentioned there was telehealth and the reimbursement of telehealth. And because of your place in the nation, I mean, you are very rural. If you could talk a little bit about, you know, you guys have been pretty innovative in terms of virtual care and telehealth all along, just because of your rural health, you know, need to address the communities that you serve. Can you talk a little bit, you know, has that, the pandemic actually helped in a way, because virtual care and telehealth is kind of more widespread now? Or what's been kind of the impact of that on you because of your ruralness?
There are many challenges in rural healthcare, as I already mentioned, and certainly the availability of virtual healthcare is really critical for our patients and for those who serve and live in our communities. When the pandemic hit, of course, we had to shut things down pretty quickly, as at that time we knew that was going to be an opportunity for us to try to control the pandemic. When that happened, we still have patients that needed acute care. We still had patients that needed chronic disease management. And we still had patients who were going to need procedures completed. So we spent a lot of time trying to figure out how best to meet our community needs. However, serving our patients during this time through virtual health was a blessing. And we provided services through telephone. We provided services real-time, face-to-face through different modalities. And our patients were thrilled that they had the opportunity to get the care that they needed, and now are even more thrilled to think that this is a way that they can continue to receive care. When you think about rural geography, our patients oftentimes have to drive 2 to 3 hours to seek care. And about 70% of our missed appointments are because people lack transportation. So we still have the issues around transportation, the lack of broadband access, but we are very proud of what we were able to do during this time with the capabilities that we had. But I think that that commitment going forward is not going to get less. Our communities know we have to continue to invest in meeting their needs, in personalized care, and in order to make it convenient and really to get the sense that patients need around the best experience that they can get in managing their care. Telehealth is here and it's going to continue to grow. And we are going to have to think about what it means from both a care delivery perspective as well as from a payment perspective.
One thing that I don't know that people know, and we are fortunate, I live in an urban area, but I think a lot of people kind of assume that we could all just kind of go to telehealth when this happened. And I know that, lack of broadband, and there are other things, in rural areas that have made this somewhat difficult. So what are some of those, if you could just speak a little bit to that and help kind of educate people somewhat on how this isn't the easiest transition to make for some, and there's still work to be done here.
We've been in the virtual health space for over 20 years. And of course, like most others, we had some reluctance in providing services through virtual means. Taking care of patients is a human business, and that face-to-face encounter and the relationship that you develop with patients is extremely important. So I think some felt that it just created barriers or wasn't as patient-centered as they would have liked. Yet when we were faced with the pandemic and realized that this was the only way we were going to be able to take care of our patients, we had to ramp it up very quickly in a way we hadn't anticipated. And as you would guess, over 20 years, the simplicity of using the technology has changed dramatically. So that has helped a lot. However, we have many patients who I already mentioned do not have broadband access. And even those that do oftentimes don't have a smartphone or another device where they could actually have that real-time visit. So we had to think about innovative ways of bringing that out to our communities through our partners across our 45,000 square miles, so that we could really meet the health challenges through that virtual means. It has been very galvanizing I think, for the providers, the clinicians, the physicians, nurses, and others who now are much more comfortable with this modality and understand that it will never replace the need for many patients to come in and be seen on a face-to-face basis. But it does allow us to do a lot of care that I believe will help meet the patient needs, and also is a way of convenience for patients and families, again, who are traveling long distances for that care.
Yeah. I mean, so certainly, you know, the challenges facing leaders such as yourself have really changed because of the pandemic. Can you talk about how the pandemic has kind of influenced some of your priorities and concerns, you know, things that you weren't thinking about 18 months ago that now you think about on a daily basis?
Yeah, you know, I would say if I had to think of my top 5 priorities, my top 5 priorities since March have been the pandemic. It's evolved during the months that we've been going through this. However, in the early stages, before the virus was widespread in Wisconsin, it was more of a personnel challenge. We shut down much of our non-urgent care to slow the spread and flatten the curve. That did involve big losses in revenue. We had to furlough some staff. We had to redeploy staff, and we had to be agile because we knew that we would likely have to dial it up and dial it down depending on where we were at with a pandemic. And then time went on and on. And as time went on and we knew more about the virus, we knew more about protective measures, we knew more about effective screening, we were able to open our system back up. But that, when that occurred, we were then hit with a major surge. And we became a national hotspot for COVID. That presented huge challenges for personnel. And then it was the whole issue around managing the staff fatigue, finding enough healthy staff, protecting staff, caring for an unusually high volume of patients. And we were also at the same time heavily involved in state and national capacity with research. We were doing testing and also all of the important things around the policy conversations that needed to occur during the pandemic. So it has really been an all-encompassing effort, and it has been a lot about a lot more than patient care. Clearly, we have many thousands of employees outside of care delivery that have been helping us manage the response, those in government relations, human resources, legal, facilities, IT, communications, and so many others. So as I think about the public priorities, and as I come back to the collective effort to the value and the investment in public health and disaster preparedness, that again is still in my top 5 priorities. So we need to really recommit to the value of medicine and to science more generally. We need to be more flexible. We need to be more aggressive in seizing new opportunities so that we can shake some of the barriers that we've had loose as we move forward. And I know that disruption is old news in healthcare, but the coming months and years will be redefined in how we view that term. And I want to harness the energy. We've had tremendous energy during this time, and I want to use it to enhance what we do for our patients, for our families, and our communities.
And this week, we had an inauguration here in Washington. So we've got a new administration coming in and a lot of kind of fresh, not necessarily fresh ideas, but new beginnings, new things happening here with public health and healthcare policy. So if you could kind of wave a magic wand, you know, what would be the new regulations or payment structures, or, you know, if you could change kind of 2 or 3 things in policy, what would you want to see happen?
Sure. Well, I think, yes, a new administration is fresh. It gives us an opportunity to begin the dialogue for changes that are going to be imperative. So I think from my perspective and where I view the world, we really need to change the way rural healthcare is reimbursed. We know that in general, the current system doesn't reflect the costs and challenges of delivering high value quality care, but that's particularly true in a rural environment. As we think about what it might look like, global budgeting is something that we find very promising. There would need to be proper safeguards, but we know that being a fully integrated system with providers, with acute care hospitals, and with a health plan, that we really do have the ability to have those capitated lives and manage them very efficiently, very effectively. I also think key to the next few years is allowing for policies that really embrace innovation and also new models of care. And technology will support a lot of that. And I think it's important for us to have those conversations, because it's really tough to pick and choose what is really going to give you the biggest return on your investment. And it's not just the technology piece, but it's a human resource that has to go into the implementation and then coordinating it across an enterprise. And, of course, we talked about telehealth. The government does need to tear down the barriers to telehealth. The pandemic has clearly demonstrated its ability to bridge access. Access is a huge issue. It's a huge issue in our area for the reasons I discussed, the geography, the economic challenges people face, but it's a challenge everywhere. So I'm very optimistic that CMS will continue to embrace the innovation around telehealth and the possibilities that it can bring to better serving our patients.
So one final question I want to ask you, and you are an incredible role model, I think. Your accomplishments are just amazing as a female CEO of one of the most prestigious healthcare organizations in the country, chair of this incredibly wonderful board of directors. But you're still in the minority. And I was actually really surprised to see these numbers. But to date, females still only hold somewhere between 13 to 20% of leadership positions in healthcare. And it's less than 10% in technology fields. So, what advice do you have for other women executives? What do you think it was that kind of helped you get ahead? Just would love to have you speak to that a bit.
Well, I think I've shared this story with you, but when I was a young child in school, my teacher told me that girls couldn't be doctors. And as it turns out, I actually cared for that teacher years later after I had indeed become a physician. And she was very thankful that I took great care of her during that time. Wow. And, I share that story because, while attitudes have thankfully changed dramatically, we have not arrived at a fully equitable society, clearly. And this is another area like public health that I've mentioned, where over this past year in 2020, we saw glaring challenges. We saw challenges with racial equity, we saw gender equity issues, and realized that these are huge systemic challenges that are going to require huge systemic solutions. So I think, we need our organizations, we need individual leaders in government to work together to really foster and create really a fairer, more equitable world of work. But for women who are living through the very real inequities of today's work world, I would say be aggressive in pursuing your leadership path. If leadership is what you want, we need you. We don't have enough women leaders in healthcare, and we need the unique perspective that women bring to really push this field forward. And it's not just about what is fair. I want to be clear about that. Healthcare can't become, it's impossible to become the best version of itself when women and when other minorities are not given equal access to opportunities to lead, to make decisions, and to really shape the healthcare environment. And I firmly believe this, and I am very proud to say that at Marshall Clinic Health System, our Chief Information Officer is a woman, as is our Chief Human Resource Officer, my Chief of Staff, the CEO of our health plan, the Chief Financial Officer of Financial Operations, and our Director of Infection Prevention and Control, all women. We will change the world.
Well, that's wonderful. And actually, one thing I was hoping you might mention before, I know you're not gonna be able to join us on Tuesday next week, but we will have Amy McDonough, who's gonna be your inherit your position next week. Do you have any advice or thoughts for her as she goes forward with the eHealth initiative?
This is such a great opportunity for eHI. And Amy is an incredibly bright woman who has tremendous energy and sees the vision and what's possible. So I'm excited to have her take over the reins. I know she'll do a fabulous job. And my advice to her is to stay true to herself and promote what she sees best with the aggregate board to really serve our communities in the way that eHI has done so tremendously well over the years.
Well, thank you so much, Dr. Turney, for your leadership and for joining us today. And we will certainly continue to watch you and work with you over the next several years. So thank you.